Diabetes is a chronic condition that affects how the body manages blood sugar. Glucose. Glucose is a vital source of energy for the body, but when the body cannot regulate it properly, it can cause damage to various organs and systems, leading to a range of health problems. There are three types of diabetes: type 1, type 2, and gestational diabetes. Here in type 1 diabetes, the insulin is completely absent. In type 2 diabetes, the body does not produce enough insulin or the body doesn't responding to the insulin formed. Gestational diabetes develops on pregnant women who had never had diabetes before. It usually resolves after delivery. In today's video, we are going to talk about the sign and symptoms of first two types of diabetes, which are type 1 and type 2. So, how can you tell if you have diabetes? The signs of diabetes can vary depending on how much sugar you have in your blood. You might not feel the signs of diabetes because they are too mild. This is especially true for type 2 diabetes. You may not realize you have it until it starts to cause serious problems in your body. On the other hand, type 1 diabetes symptoms happen quickly and are more severe. They can appear in just a few days or weeks. Let's now look at the early sign of diabetes, which are common in both type 1 and type 2 diabetes. The first one is feeling very hungry and tired. When you eat food, your body turns it into a kind of sugar called glucose. Your cells use this sugar for energy. But to get the sugar into your cells, your body needs a special substance called insulin. If your body doesn't make enough insulin, or if your cells don't listen to the insulin that's there, the sugar can't get into your cells. This means your body doesn't have enough energy, which can make you feel really hungry and extra tired. Next, we have need to pee more often and feeling more thirsty than usual. Normally, a person goes to pee about 4 to 7 times a day. But people with diabetes may go a lot more because their blood sugar is too high. When your blood sugar is high, your kidneys can't absorb all the sugar and it comes out in your pee. This means you make more pee than usual and you lose fluids from your body. Because you're losing so much fluid, you may feel very thirsty and drink more. But when you drink more, you'll also pee more. Next, your mouth feels dry and feel itchy on your skin. When you pee a lot, your body loses a lot of fluid. This can make you dehydrated, which means you don't have enough water in your body. When you're dehydrated, your mouth can feel dry. Also, because your body doesn't have enough water, your skin can become dry and itchy. Next, blurry vision. When the fluid levels in your body change, the lenses in your eyes can get bigger and change their shape. This can make it hard for you to see things clearly because your eyes can't focus properly. Let's now look at the symptoms of diabetes. These symptoms usually appear when your blood sugar has been high for a long time. The first one is fungal infection. People with diabetes, both men and women, can get infections caused by yeast or fungal infection. Yeast is a type of germ that grows more when there is a lot of sugar around, which is often the case in people with high blood sugar. Infections can develop in any area where the skin is warm and moist, such as between the toes and fingers, underneath the breasts, and in or around the genital area. Next, slow healing wounds or cuts. When you have high blood sugar for a long time, it can harm the blood flow and nerves in your body. This can cause problems with healing cuts and wounds because the body has a hard time getting the nutrients it needs to heal. Additionally, nerve damage can make it harder for your body to heal the wound, which slows down the healing process. Next, feeling of pain or numbness in your legs or feet. When nerves are damaged due to high blood sugar, it can lead to a feeling of pain or numbness in your feet or legs. This happens because the nerves that control sensation and movement in these areas are affected, making it harder for you to feel things or move around comfortably. Next, lose weight unintentionally. If your body can't use food to get energy, it will use your muscles and fat instead. This can make you lose weight without trying to eat less. Next, nausea and vomiting. When your body uses fat for energy, it makes a chemical called ketones. If there are too many ketones in your blood, it can make you really sick, and it's called diabetic ketoacidosis. You may feel like throwing up. When diabetes is not well managed, it can cause many health problems. When your blood sugar is very high and you become very dehydrated, it can be very dangerous. This can cause a condition called diabetic coma, which can lead to death. Both types of diabetes can cause this problem. Symptoms of diabetic coma may include elevated blood glucose level over 600 milligrams per deciliter, excessive thirst, dehydrated mouth, heated and arid skin that doesn't perspire, high fever over 101 Fahrenheit, lack of mental clarity or drowsiness, impaired eyesight, delusions, and unilateral body weakness. So, when should we visit a doctor? If you are 45 or older, or have other risks for diabetes, it is important to get tested. Early detection of diabetes can help prevent nerve damage, heart problems, and other complications. You should contact your doctor if you experience symptoms like feeling sick, weak, and very thirsty, frequent urination, severe abdominal pain, rapid and deep breathing, sweet breath odor similar to nail polish remover, which is a sign of very high ketones in your blood,